The next presentation is Krenar from Kosovo.
Hello everyone, thank you Eres for invitation. Ladies and gentlemen, it's a great pleasure to be presenting my work for a long time, including Tixel. So let me introduce myself really quickly. I'm from Kosovo, from Pristina. I own the Estetika clinic and I'm a teaching assistant at the University College of Medical Sciences, Rezonanza. I have many publications. I'm very active on different medias and also on social media. Just recently, I have finished my aesthetic documentary and I'm about to open up my second clinic, including plastic surgery, and this is me with my students at the faculty. Let me go through the milestones really quickly. In 2012, I opened up the clinic, and then in 2014, I had the clinic expansion, and then in 2016, I started as a teaching assistant and a huge market research. And when I say a huge market research, I really did go to numerous congresses and fairs in Paris, in Munich, in Zurich, in Oslo, in Dubai, in Istanbul, and I was in a pursuit of a device that could treat many different indications. That is active acne, because I wanted my patients to get really good results in acne, because not a lot of devices would offer that. And then I wanted to treat scars, and then I wanted to treat stretch marks, wrinkles, melasma. Basically, I wanted to rejuvenate the skin. So that happened in 2018 when I actually found Tixel, and this is me celebrating with my team with a cake. And then in 2019, I moved on with new lasers, and in 2022, that's me working at the new clinic, which is going to be open soon. So I believe many of us are well aware of the fact of gerascophobia, which is the fear of growing older. And not a lot of people know it. They have it, but they don't know they have it. And so if we're about to Google it a little bit, how to overcome the fear of aging, the list goes on. And the Google says you have to change your perspective, you have to learn to love yourself, you have to accept the aging process, which we're going to be focused upon. And then you have to live in gratitude, make every moment count, stop comparing, live for others, and the list goes on. So what are the trends in 2022? You see before and after. A lot of people are aware that things might be wrong and they don't want to look ugly. So people want fast results. They want no to little downtime. They want no side effects. They want radiation-free technologies. They don't want to become stereotypes. That is, they don't want to become twins in the streets with other people. And that is, a lot of people are using topicals, collagen vitamins, and some novel skincare products. So we know the treatments, we have lots of treatments, and the before speakers, they had really good presentations, and they document a lot of lasers, EBDs, peels, PRPs, microneedling fillers, Botox, and the list goes on. So what we do in our clinic, we do many different combinations. Of course, we have the Tixel, the Harmony Cell Pro, the XM Prime. We have the Tricopad, different novel products, vitamins, cocktails, and so forth. And the way I see the combinations is as if I'm playing chess. I'm a huge fan of chess, however, I'm not professional at it. But the way I see when the patient comes in, I see that I really can work in different modalities, different combinations, and there's the risk and benefit ratio. So you have to really be cautious what you're doing with the patient, with the skin. However, if you have many technologies, they do provide you synergistic effects. So we have a variety of choices. Of course, all of you, I believe you do, once the patient comes in, we take the anamnesis, the facial analysis, we check for the allergies, and a lot of companies, they would advise their clinicians to always set realistic expectations. However, in our case, we try to lower the expectations so that the patients, once they see the end result, they'll be even happier. Of course, we talk about contraindications, and we try to avoid over-expecting patients. And this is tough. I believe you have patients like this. and it's really hard to get away from them, because the more you tell them to go away, the more they want to come back. When the patients come in, sometimes they refer to the skin as fixing something, fixing a scar or a wrinkle or whatever. So we tend to keep them, telling them that we're not handymans here. You know, treating the skin is much more than treating a wrinkle. I see it as a concept that can be built from within, with improving the quality, the radiance, the texture, and then the tightening and the lifting as well. And that is stimulating the neocollagenesis, then collagen type 1, then the collagen, then the fibroblasts, so the whole integrity of the skin. So we have already talked about the Tixel indications. So we know Tixel treats a lot of different indications, starting from wrinkles, skin discoloration, sun damages, skin tone, age spots, acne scars, active acne, and list goes on. And this is what I call Tixel in my clinic. I call it a skin ironing technique. This is the symbolic name. It's not from Novoxel. I did it. Because when I tell to my patients that we're going to perform a Tixel session, not a lot of them will remember it. But if I tell them that we're going to iron your skin, they start laughing first, and second, they never forget. Then they come back and they say, I want this ironing technique, please. And say, of course, we're here to do that. And so I keep telling that you know what, you have Tixel at home, you have the iron that you iron your clothes, but please be careful, because you have to be really fast with the skin. You have to be around 8 to 10 milliseconds to touch the skin, otherwise all the skin will remain on the plate of the iron. Please don't try it at home. So what are the Tixel advantages? This is my perspective. Tixel is fast. Maximally an hour, including the topicals, the LED mask. It's easy to perform, as you have previously mentioned. There are no side effects, including PIH, PIE, scarring, or dermatitis. And of course, it has good income, fast ROI. Patients like the results because it creates synergistic effects with other modalities. My personal experience, number one, it's all year round. Since 2018, I've been applying Tixel during all seasons. However, during the summer, I was more cautious. Number two, it allows me to combine it with different modalities for best outcomes. Number three, it's for everybody. My record, the lowest one, the patient was 17, and my eldest is 81. So basically, all the patients. And number four, it has long-lasting results. So they can be seen relatively fast, however, they are long-lasting as well. So when I got Tixel, I had an aim, and my aim was to reach 1,000 treatments, and now I'm beyond it. And my other record is I've had a patient whom I've treated for 2 sessions for 5,500 pulses, all body, including face, neck, décolleté, the arms, the thighs, and the back. That is for the stretch marks, so it took me quite a lot of work. I want to share with you really quickly the documentary show which I have made just recently. It has taken me 1 year of dedication, and I mean no resting days, including Sundays. I've had some training, some self-improvement trainings, and I've only taken severe cases because I wanted to show what skin science can really do, including Tixel. This is a trailer that I would like to share with you. The subtitles are in English, so you will understand it.
Unë jam asistent magjistri i shkencës Krenar Dobroshi, ligjërues në Kolegjin e Shkencave Mjekësore e Rezonanca. Jam fitues i disa çmimeve ndërkombëtare. Dukja ka shumë rëndësi për individin. Gjatë këtij cikli do të shihni se si përmirësimi i pamjes së jashtme do të ndikojë në ndryshimin e gjendjes së brendshme të personazheve pjesëmarrëse, duke I dhënë një kualitet të ri jetës së tyre.
Hope you liked it. And so I'm going to talk about only Tixel cases, what my protocols are. I tend to set different combinations on the patients, and I like working on the high settings. My favorite is 16700, but not a lot of patients can take it, so I work on 14700. If the patient can take it, then I go lower, 12500, and really rarely I work 10500, and that is only during the summer. And I did not know before, but a lot of patients, they tend to call me Indian doctor, because Indian doctors, they know the trick. They know that the higher they work on the skin, the better results they get. So I like working high, I like seeing good results. For melasma, for example, I tend to work 6400, and I always use the fusion serums. And this is really interesting that in the previous slides, I've seen during your presentations that you've been using fusion all the time, and I really like fusion. And I always tend to increase the parameters, 10 to 20% in every session, and it depends on the patients how much pain they can take. What is really interesting that I like working on really high pulses. My average is 500 to 550 per session for an average sized face. However, if I have a patient with a bigger sized face, I tend to work even higher. And we know that the protocol says 300 to 350 shots. However, I don't like missing spots. I like overlapping of at least 20%, and I like doubling the shots. The average for face, neck, and décolleté is 1100 to 1300 pulses. And just recently, just before I got here 2 or 3 days ago, I had a patient, a male patient, and I did exactly 1,653 shots for face, neck, and the other side of the neck as well. We did work a lot. And I always tend to apply serums, epithelial creams, LED mask, rejuvenating mask as well. My favorite is SPF 50, including the tinted formula plus epithelial creams. I tend to ask the patients not to put any makeup for at least 5 days and no gym 3 to 5 more days. The following is a short video which shows the way I've been working during my aesthetic show using solely Tixel. Tixel presentation. Now I'm going to share with you the real cases. The following are only using Tixel device, and I have permission for the following patients. However, I have many more results, and it's a pity because not a lot of patients, as you know, are willing to share their faces. This is the case number 1, an older lady. She was really nice, and as you can see, she has deep elastosis, wrinkles, sagging skin, and overall melasma. This is before and after, only 1 session, high settings. And here we could prove that skin rejuvenation and tightening is really possible with Tixel, including only 1 session before and after. If I'm not mistaken, 4 weeks later, I've treated the face all over. This is another case, a young lady. You can see some wrinkles in the neck, and this is before and after, only 1 session. If I'm not mistaken, I've been working not a very, very high parameter in this case. It should have been around 10,500. This is a case that I like because this is a good indication what skin rejuvenation and anti-wrinkles would look like. As I said just earlier, that we're not handymans here. We try to fix not only wrinkles, but we're trying to emphasize all the skin, the new quality of the skin, the rejuvenation, what rejuvenation looks like. It's really seen here. And in person, the client or the patient is even a lot happy. This is a good indication about melasma. This is only 1 session, 3 weeks later, before and after. We can see the other sides as well, good reduction. This is another case as well. 3 weeks later, only 1 session, you see hyperpigmentation around the ocular area. The followings are the combos that I like to treat the patients, and I personalize the treatments according to their needs, because we all know that they create synergistic effects. So my other record is 6 combos per day per same patient. So I've been working in that patient a lot. I don't have her picture because she was not willing to. This is skin rejuvenation and tightening. We've been using different modalities as well for overall improvement. This is another indication before and after. Here I've been using only 1 session of Tixel and 1 more session of IVL, a different technology, so the results are pretty good. This is an acne treatment. This is before and after. She has had persistent acne, grade 3. And what's interesting that she might still have some acne here and there. However, the healing process is a lot faster compared to before. So if she would get an acne now, it would be healed by itself. This is another indication of acne, scarring, PIH, PIE, you name it, whatever it is. The patient was difficult to treat. She was my case during the aesthetic show. And her acne were stubborn, and she was stubborn as well because she would not take the recommendations, and thus it took us more time. However, we could see good improvements. This is another case of before and after. This is 2 sessions of Tixel, including adult acne and skin rejuvenation overall. Now I'm going to show you a really difficult case which has been during my aesthetic documentary. This is fat reduction, stretch marks. This is the pre-treatment, and she's only 27, 2 pregnancies, no physical activity, and unhealthy diet. So when we took this patient in, we were not concerned about losing fat, but I was concerned of something else, and that was the reason why I have taken her. And that is the weight loss nightmare, because the sagging skin and the stretch marks would appear definitely, which is a huge risk. And this is really the reason why I picked her up. And I wanted to show that the technologies can really work well on the skin. So this is post-5 reduction treatments. This is how the skin would look like. So the question is it better in this way or better in sagging skin? So the question remains in the past because we already have the result. And this is before and after. I've been using high settings on different technologies as well, and this is after her skin was sagged, and this is completely before and after the weight loss, and we could see the size as well, the improvement of stretch marks all over. And her face, that is before and after. What is really interesting that this can show to the world that a person only with a better lifestyle and a good diet can really improve the skin without even having any combinations on the face. I haven't touched her face for a single treatment at all. This is a combined treatment before and after, persistent acne as well as scarring. Another case, she was resistant to antibiotics, so we took her with Tixel, high settings, and would have really good results. Another combination, acne treatment, skin rejuvenation. This is an interesting case. You can see on the left temporal area, he had a scar, a burned skin. Maybe he was around 4 years old. And we can see good improvements on the left side and overall skin rejuvenation. On the hands as well, we see good improvements in only 1 session. I've been working on high settings on the hands because the hands tend not to hurt that much, so we can increase the parameters. This is another case of stretch marks before and after, really high parameters, 16,700, 2 sessions. And this is my last case, a young man. He had only a cyst removal, nothing serious. However, his skin sagged, and we took it from there. We did a couple of combinations, Tixel and IVL. So we improved the skin quality, the tightening effect, and of course the color. So this is my team. We thank you all. Faleminderit.
Thank you, Krenar, for this wonderful presentation.
You're welcome.